Let's talk about body contouring and what exactly is body contouring. And it's such a generalized word that actually people use nowadays, but what exactly does it mean? So as you can imagine, body contouring mainly, we're going to focus on the body, not the breast, but body contouring usually implies creating a waist, adjusting the hip area so that it's more rounded, and flattening the tummy. And that entire process involves 3 main procedures. Number 1, it's liposuction. Number 2 is fat transfer. And number 3, it's a tummy tuck. Now, you don't necessarily need all 3 depending on your body shape, but these are the 3 main things that are used in terms of performing the procedure. Now, liposuction tends to be performed using a very small incision, and there's a cannula that we put in and actually suck out the fat, literally. So as you can imagine, if we remove the fat in targeted areas, such as the back and the waist and the flank area, which is the love handles, and then inject it in the buttock area to create a rounded shape, you can really alter the body shape very nicely. So when you then, if there is loose skin in the abdomen at the same time, for example, during a mummy makeover, or someone who's had several kids, or someone who just has extra skin in the lower abdomen, in those situations, it's really nice to combine the liposuction with fat transfer and then with the actual tummy tuck. So how do I do those procedures? Patients come on the day of the surgery, we do the markings. We often start surgery with the patient lying on their tummy. So for example, this is the patient. And I tend to make 1 incision here and 1 incision in the buttock area here. And using those incisions, we lipo this entire area. So we end up having, you can essentially shape this and lipo this area here. So you kind of shape this whole area just using small incisions. And then we purify that fat and we tend to inject it in certain areas, for example, to round out the outer hip for the hip dips, or the upper buttock, or even around the buttock to create a shape. Patient is then turned on the back, and we then go back, liposuction the waist in the front, and do the tummy tuck. Now, so how is a tummy tuck performed? So for example, this is the patient, now we've turned her, we've liposuctioned the waist, and a tummy tuck is usually targets 3 things. Number 1, it targets the extra skin in the abdomen. Number 2, it targets the fact that the muscle is open. And then number 3, it targets the waist. So if this is the tummy, and this is the belly button, and then there's some extra skin here and extra skin here. So normally when we do a tummy tuck, we remove this whole skin and we leave the belly button where it is. We then elevate this area, and if this is the muscle tends to be open. We stitch the muscle back to where it was before the pregnancy, and then we bring that skin down to the other one and make a new opening for the belly button. So at the end, you will have a more contoured waist, an incision at the bottom, and a tiny incision around the belly button with flatter abdomen. So after doing this, then we decide whether we need to add any fat to the hip area for the hip dips or not, and that can also be done at the end. So for body contouring, in summary, we combine liposuction, front and back, along with fat transfer for a shapelier hip, I would say, and finally, with or without a tummy tuck, depending on whether one needs to have a tummy tuck or not.